My name's Ruth Barker and I work within the Evaluation and Insights team at Health Innovation West of England as the Senior Insights Manager. So it's really great to see so many people here joining us today. There are other members of the Evaluation and Insights team on the webinar today from Health Innovation West of England. So as we get through the webinar and we begin the Q&A, please do pop some questions in the chat, and I'll invite colleagues to support answering those questions if they feel like they would like to as well at the end. So just as we start the webinar, it would just be really good to get a feel for, I guess, people's confidence around real world evaluation. So if people could pop in the chat on a scale of 1 to 10, 1 not being confident at all and 10 being very confident, how confident do you feel about real world evaluations? And that could be delivery of them, how you might plan them, how you might interpret findings from an evaluation. I think use your own gauge of how you want to apply that scale. And again, it'd be really nice just to get a feel in the chat of what one thing you might want to learn today when you're thinking about your confidence level. So I'll give people a minute just to think about that. I can see people have popped some 5, 6s, 7s, a couple at the lower end of that scale of not very confident. I can see some people have qualified that with maybe a bit more confident qualitatively than quantitatively. I can see someone's popped in. They'd like to learn about the structures for evaluation to add rigor, which is great to know. Hopefully we can do that. And if there's any questions at the end about that, very happy to pick those up as well. Thank you, everybody, for popping that in the chat. It's useful to know who we've got in the room. So before we move into today's webinar, I think it might just be useful to place in context what the HINs are, what the Health Innovation Network is, and I guess how we work. So there are 15 health innovation networks across England. We were formerly called Academic Health Science Networks, and we've been around since about 2013. And we operate as kind of within the innovation arm of the NHS is how we often describe ourselves. I guess our collective aim as health innovation networks is to help the spread of innovation, and we work across health and social care. I won't go into lots of detail about what our work programme at West of England looks like, but please do look at the website and look at the other Health Innovation Network websites for the type of work that we do across the network if you're interested in seeing a bit more detail about that. So moving into the webinar today, this is, I guess, the key objective that I'm hoping we can start to answer. So what evidence and evaluation is required to be successful in health and social care? This comes to a degree from an innovator perspective. So if you've got an innovation or something you would like to implement within health and social care, how might we need to generate evidence in order to be able to say we think this would be of value to health and social care? And so today the plan will be to think about what is real world evaluation and why we do real world evaluation, and then I guess quite importantly how we might then start to think about doing real world evaluations. So starting with that question of what is real world evaluation, we ask I guess essentially 3 key questions. So we pose the question, does the innovation, the thing we want to implement, the new model of care, this new role we're thinking about, does it work? The next key question we might ask ourselves is, well, why and how is that innovation, the thing we want to implement, that new model of care, that new role, how and why does it work? And can we evidence that? And then the last question we I guess commonly ask ourselves when we think about real world evaluations is it worth, from a financial and economic perspective, worth doing the thing? Is it worth procuring the innovation and it being commissioned? Is it worth implementing the new tool, piece of equipment? Is it worth employing people in those new roles? Are they delivering what we would expect them to make it, economically or financially viable and a sensible decision to make. So they're, I guess, the three key questions that we think about when we're thinking about real world evaluation broadly. Obviously, we get more nuanced than that once we start to scope out the work, but that's generally the three buckets they fall into. And so often those inform why we're doing the evaluation in the first place. So we're thinking, we need evidence in order to demonstrate a value proposition or to inform a business case. So, we need to be saying, we can demonstrate, we have evidence to demonstrate that this is, either cost of, the cost of this thing is worth investing in. We want to be able to say, the impact of the thing, the innovation, the new model of care, that new role, it's having an impact, and this is the size of the impact it's having, and this is the, so therefore we can say it's got, we can demonstrate it's got this much value. And actually then from a decision making point of view, you can rationalize why someone may say, yes, we'll continue to do this, or we think it's a good idea that this is something that we adopt and we spread. And the other really important thing to think about is when we are doing things, putting in place an innovation or an intervention, or we're putting in place a new model of care, we might want to do that and learn in cycles to be able to do something and iterate that so we can make it the most effective thing that we put in place. So there's lots of reasons why we might do a real world evaluation, and these are often driven by what the innovation is or what the model of care is and what we essentially want to learn and who we're generating that evidence for. I haven't lingered too much on the what and the why, because I think quite often within health and social care, we're really passionate, we really understand what our drivers are, we really understand what the problem statement is. I think I'm going to focus in today on kind of the how we do real world evaluation, because I think commonly that's where people then get stuck. They can think of an idea, or they can identify where there might be a problem and what that solution might be, but generating the evidence around that is commonly then the barrier to being able to say, well, this is why I'd like this informs a business case and why I'd like it, commissioned going forward, or being able to, explain to other clinicians, for example, or people who work in health and social care as to why it's of value potentially for that scale and spread. So I'm going to go back to those three questions that I flagged earlier, which was, does it work? Does the innovation, does the intervention, does the model of care, does that new role, does it work? And when we're asking that question, we tend to consider those as impact evaluations. So what I'll do is I'll cover off each of these types of evaluations separately as I go through the next series of slides. And so when we say, does something work, we're thinking, what's the impact of that thing? Is it having the effect that we think it might have? When we're thinking about the question of why and how does the thing work, we're talking about a process evaluation. And then when we're talking about, is it worth it financially, we're thinking about the economics, so thinking about an economic evaluation. And then across the board, when we're thinking about the types of evaluation, when we're thinking about the type of question, the other thing that we consider is, are we going to do a summative evaluation, or are we going to do a formative evaluation? So from a summative evaluation, what we're talking is about doing an evaluation after something has been implemented or scaled to understand, has it worked, or why and how did it work? When we talk about a formative evaluation, we're talking about, as we're implementing, we're talking about collecting evidence, generating evidence, potentially at multiple time points, or doing kind of temperature checks to kind of understand and iterate. So there's different types of evaluation you might consider when doing the planning of how to do you want to do your evaluation. So if we start with impact evaluation, so that question of does it work? What I've got here is, and I'm not going to linger too long on this, but is what we call the hierarchy of evidence. So when we're talking about generating evidence within real world evaluations, often when we're talking about research, potentially we're talking about randomized controlled trials, we're talking about maybe systematic reviews, we're talking about specific methodologies or designs. When we're talking about real world evaluation, we're potentially considering slightly different methodologies, potentially trials or kind of controlled groups, but that aren't randomized. So that's called quasi-experimental methods. We might be looking at case controls, pre-post studies, looking for mixed method studies that are informed by qualitative data and descriptive statistics, for example. So the type of evidence we might be generating within real world evaluations isn't necessarily going to be the same type of evidence we would consider at the top of that hierarchy of evidence. But equally, it doesn't devalue the, why we might want to do a real world evaluation. The challenge, I guess, with research is it's often done in really tightly controlled, really well controlled environments, which is great. But sometimes we don't necessarily know the answer to how we then see those same impacts when we take it out of that highly controlled environment and put it into a complex system like the health and social care system is. So it's just to flag that when we're thinking about the types of evidence within an impact evaluation, we might be these are the types of methodologies that we would, or types of designs we would be thinking about implementing and using. And I think it's really just to say as well that there is no one right type of evidence to generate within an impact evaluation. I think it's really important that you understand what the need of the person who you're developing the evidence for, what they might need to see. So if it's a commissioner or you're looking to evidence a business case, it might be really important to understand what those people who are going to be making those procurement decisions need to see in terms of evidence, which might inform the design that you take when doing an impact evaluation. So if they really need to understand the impact of something from, say, a patient or a service user perspective, and they're really interested in stories, collecting quantitative numerical data might not actually meet the needs of what they need in terms of evidence. You might be much better off doing something that's qualitatively focused, so collecting that experience and really understanding the perspectives of individuals in that way. So I think it's just really important to think about what the need of the person who's going to be using that evidence might need it for, and and then that can help inform the design that you pick. It also depends on the stage of the innovation. So depending on where the innovation or the thing is, you might pick a different design. Again, it really comes down to making that specific and individual choice. And then again, when thinking about generating evidence, there are guidelines, for example, that are available for generating evidence around digital health technology. So it's really worth going to have a look at guidance on what type of evidence you might want to generate if it's, for example, a digital technology. And then that might help inform the decision around what type of design or what type of methodology you put in place and as you start to plan your evaluation. So when we're thinking about evaluating impact, there's sort of 3 key steps to work through. So the first one is thinking through what problem are you seeking to address, and and for who. So I've put 3 potential key stakeholders here. This is not exhaustive. It's really important at the start of an impact evaluation, you're thinking about who your key stakeholders are, thinking about stakeholder mapping, thinking about the type of investment those different stakeholders have, and what you might need to, is it the same problem for all of those stakeholders, or actually does the problem that you're looking to understand and from the impact evaluation, does that look slightly different from a patient perspective versus a staff perspective versus an organizational or a system level? And once you've really understood your problem statement, at that point you can then start to define and talk and kind of elicit that theory of change. So it's saying, this is the problem, this is what I'm looking to solve, I think this is the potential solution. And then your theory of change gives you a really clear way to articulate how you will go from putting that solution in place to being able to measure this series of outcomes and impacts, to be able to generate that evidence. And commonly where we start when we think about a theory of change is we say, so this is the problem statement, this is what we're looking to solve, this is the solution we think we will help solve that problem, and this is the impact we want it to have, and then work backwards. And so then we can really start to, for example, understand what it is we then need to measure. So then that's the third part. So once we really understand the outcomes and impacts and the types of activities we're going to do to deliver that solution, we can say, so in order to be able to measure that impact, I need to be able to measure X, Y, and Z. So if we take an innovation or something that's intending to reduce the number of hospital admissions, you would need to measure, for example, admission rates as part of your measurement frame. And then when you're thinking about the measurement frame, you're thinking, okay, so where does the data related to hospital admissions exist? Who owns that data? How easy will it be for me to get that data? Is it comprehensive? Is it up to date, or is there a time lag? So by working through these three steps, so what are the problems that's looking to be solved, and kind of what does that problem look like for your different stakeholders, developing that theory of change to explain how by putting in a certain solution you'll be solving the problem, and this is then how you're going to measure the impacts. You come up with a really robust plan, and planning's really important. Planning up front means that actually the delivery of an evaluation almost feels much simpler and much less challenging, because you can unblock a lot of challenges that come up in terms of data access, or getting to the end of an evaluation and thinking, oh, I've missed a data point that would have been really valuable because I hadn't mapped out all of my impacts, so I hadn't understood what I needed to measure. So it helps you probably problem solve things or identify areas where you need to do some thinking before you start. So it's just thinking about this as a process. And so I think the next key thing to talk about then is process evaluation. So we've talked about designing an evaluation or thinking about an impact evaluation, and then it's kind of saying, does it work? The process evaluation is saying why and how does it work. So when we think about evaluating processes, we want to think about this in potentially a slightly different way, just because we're not necessarily looking at say patient outcomes in terms of say their quality of life, or their or whether or not, for example, we've seen a reduction in say hospitalizations or GP visits required. What we're interested here in is understanding, for example, how might someone have experienced that innovation, the thing that you've implemented, that new model of care. So in this sense, we would be thinking about the context that we're doing things in. So we've got this, say, a model of care. We're thinking about, okay, so we're going to implement this in primary care with this patient population, and we're going to do it at this point in the care pathway. In order to then unpick that context a little bit more, we want to do a really clear, what we call like an intervention description. So really understand what that intervention looks like. So where is it interrupting or disrupting that care pathway, in order, say, to potentially make it more efficient, or take steps out, or make, for example, get someone to a point of referral quicker, or a point of diagnosis quicker, or getting a more comprehensive intervention. Where are those interactions with that kind of care pathway, for example? And you might map out the new pathway, and then you might map out what is the existing pathway, or the pathway as it currently looks, so that you can kind of understand where those changes are. You would then do the implementation of the thing, implement the new innovation, the new model of care, the new piece of equipment, put that, employ people to deliver, be in that new role that you have considered a really potentially important role. And then you would then start to measure, for example, either depending on what you're looking to achieve, you might observe how that's happening to understand, is it working as intended? Are there things that are happening that, for example, you think the new pathway is going to work in a certain way, but actually it doesn't? If you back through, say, observation, you might be able to see, well, actually, when this part of the new pathway that we thought would happen hasn't happened, and it's because of this that we've seen. You might be interested in understanding how, say, for example, if you put something in place, how do staff feel about that? So you might interview staff, you might survey staff. Same with patients. If you're changing a care pathway and they've got experience of the previous or prior care pathway, you might be thinking, okay, well, what's patients' experience of this new way of doing things? Do they view it positively? Actually, is it disruptive and they're not finding it helpful? There's lots of things you could consider to collect evidence around, and it really depends, a bit like when I just mentioned about impact evaluations, really thinking about who you need to understand the perspective from. So it might be that the focus of your evaluation might be around improving patient experience or patient satisfaction. It might be related to, improving, staff experience or staff satisfaction. It might be at an organizational level. You're wanting to understand, do these processes, how are these processes working, and why are they working in the way that they are? So when you're thinking about process evaluation, you might want to think about it in these steps and measure it in this way. And then on this side, what I have included is just two theories that could be applied when doing process evaluation. So when we're doing a process evaluation, quite often the things that we put in place, we're intending to change somebody's behaviour. We're intending to potentially change how patients, for example, self-management tools, for example, we're looking to change patients' behaviour. So actually underpinning your thinking when designing a process evaluation, you might want to think, what's my intervention behaviour is my intervention looking to target? The other thing with process evaluations is often when we're thinking about embedding something into a system or a service or a new pathway, or we might want to understand, how is that working? Is it being embedded into normal practice? And there is implementation theory. So, you could consider, say, for example, applying normalization process theory, or there's lots of other theories that exist that could be underpinning the methodology that you pick when doing a process evaluation. And Maireada's very helpfully put in the chat, I can see the link to the MRC guidance on process evaluations of complex interventions. So that's a really good starting point. If people, it's a really comprehensive document and a really good starting point to go and read through if you're thinking about doing a process evaluation. So the last, type of evaluation, as those three big buckets that I mentioned earlier, is an economic evaluation. So it's thinking about, is it worth it? So financially and economically, is it worth doing? So what we have on this slide is you'll see on that where we've got the scales. So we've got different types of economic evaluations we can do, and it's really thinking about what does it you need to evidence and what's realistic and viable to evidence when doing an economic evaluation. It's also really sensible to think about who is the audience of that economic evaluation potentially. So if we think about commissioners or say people who manage the budgets within health and social care, quite often their main focus is on cost benefit analysis, thinking about budget impact, thinking about return on investment. But then, for example, if we're looking at an innovation that is potentially a technology that, you know, an innovator may want to think about scale and spread, it might be worth thinking about, well, actually, do we need to do, say, a cost effectiveness analysis and think about QALYs and ISAs and actually think about it from that perspective, because it might be that they want NICE might be the person who's going to be the main person that evidence is being generated for in the longer term. So it's just really thinking about who the evidence is being generated for, and then it might also help inform the type of economic evaluation that you want to do. I think again, I think it's really, we have a webinar next week, which is specifically focusing on health economics. That's doing a deeper dive into health economics. So if people are interested in health economics and implementation economics, please do join the webinar next week. We've got a health economist. We've got 2 health economists presenting that session, so they'll go into more detail into some of this. I am going to briefly talk about the graph, or that kind of plane that's on this slide as well. But again, this will be talked about in more detail at the webinar next week. So this graph, where it's got the cross and the tick, and then the question mark, and then the 3 question mark, this is essentially when we think about innovation, or we think about the economics of something. So in that box where there's a cross, what we're essentially saying is the innovation, the thing that you're implementing, the new model of care, is more costly and less effective than the thing that you've compared it to, so where you were before. So at no point is that ever going to be considered a sensible thing to commission or procure, because it costs more money, it's less effective, it's not that wouldn't be a decision we ever make. Where the box with the ticks in it ticking is this unicorn. So this is where everybody would love their innovation or model of care or intervention to be. So this is when it's more effective and actually less costly. So there's almost no thought there needed. It seems really sensible that you would make a decision to procure or commission that thing, because it's clearly more valuable to health and social, to either patients or staff or the system from an economics perspective, compared to what you were looking at, either the pathway previously or the innovation that you have had in place previously. On that line where it's the 3 question marks, that's essentially saying it's less effective and less costly. Now, we live in a world within health and social care where we don't have endless funds, and we do, we are regularly looking to make savings, reduce costs, but it's potentially very difficult to justify, even if something costs less, to reduce the quality of care that, say, someone might receive. So there's 3 question marks in that one, because it's kind of, you would have to be really clear about, for example, a commissioner, or we have to be really clear about the evidence case there to say we're recommending something that's less effective, even if it saves money. And then the box where there's the question mark is kind of where a lot of innovations or things that we implement sit. So it's saying it's potentially more costly, but actually it's also potentially more effective. So if it sits below the line or above the line is where that decision making has to be put in place, or that decision making happens. So if it's more costly and more effective, and then you can demonstrate that there is potentially either the budget or it's of value, enough value to spend that extra money, then you may consider it. So that's the box where I think a lot of the decisions are made. The other boxes tend to be a bit more clear cut about, if it sits in this box, it's either a definite yes, a definite no, or it's very likely to be a no. as I say, we've got a webinar next week. Jamie has put the link to the webinar next week in the chat if economics is something that you're particularly interested in understanding a bit more about. I have come to the end of my slides in terms of talking through the types of evaluation. I am going to do about not quite the rest of the session or for a Q&A. I'm just going to skip through the last slides, then we've then got time to do a Q&A for the rest of the session. So just to say, I guess the key messages from what I've just shared back is, it seems like quite a lot. There's lots of things to think through. There's lots of steps. There's, from the very outset, lots of prep work to do in terms of engaging with stakeholders, understanding the problem statement, understanding what that means for the area, your say region or your particular sector. But I think it's just breaking it down into steps and engaging with people who might have knowledge about each of those individual steps, so that it doesn't feel quite so such a big hill to climb to get to the point of having an evaluation planned and conducted. And I think the key thing is, teams are really important. Evaluations are most effective and most efficient when you have a range of skills and a range of people. You bring your subject matter experts in terms of the particular area that you're interested in doing an evaluation in. You bring your people who might have particular skills or knowledge about that methodology you're interested in. People might, for example, BI teams or transformation teams might really understand the data that exists around the types of evidence that you might want to generate evidence around. So it's, bringing in all of those relevant people. So what feels like a lot will then hopefully begin to feel like a less big task to try and do as a kind of solo person. I think the key thing as well is, if you're thinking about implementing an innovation, or you're thinking about making a change within within the way you work or the system that you work, the place that you work, start to think about evaluation at the start of thinking about that project. When you're starting to think about your problem statement and the solution, think about how you might measure those things or what you might need to generate evidence around. And I think I've probably said this a lot today already, but start with the problem. Really understand what it is that you're trying to solve before jumping straight to a solution. Quite often we see what we think are really good solutions, but make assumptions about this thing will solve the problem that I've recognized. So I think it is going back to the problem and really understanding, is this solution genuinely going to solve the problem that I have? And that feeds nicely into the next point is, in order to generate evidence and to be, I guess, successfully implement an innovation and make something really feel valuable to health and social care, if you're the person as an innovator generating the ideas, and make it, really work out what the problem is that the system needs to solve, and then build your innovation around that, rather than building an innovation, making, again, assumptions about what it is that the problems that the system have, and then actually it might not be quite fit for purpose, or it might not quite solve the problem. So actually it's never going to be something that is going to be adopted and taken up within health and social care. And I've put the last one in here, but I think I've put HINs and commissioners, because as health innovation networks, we have lots of experience of working with innovators. We also have experienced teams in doing evaluations and kind of the delivery and implementation and scale of innovations. And again, talk to commissioners. It's really key to understand the landscape that you're thinking about making changes in before going too far down the line, because if there isn't the appetite, even if you generate the best evidence in the world, it potentially still isn't going to be adequate for those changes to be adopted and scaled.